Thank you so much for joining us. We're really excited to talk about prevention. My name is Lucy. I work with the Freedom Story. We work in the area of prevention with children and young people in northern Thailand. And I'm very excited to have such esteemed colleagues here with me on our panel. And so I'm going to have everyone introduce themselves and talk a little bit about the work that they do in prevention and the changes or the trends that they're seeing in vulnerability in each of the contexts that they work in. And then we'll have some time for Q&A as well. So Punork, would you like to kick us off? Yep, either one, whatever works. Yeah, okay.
Hello, good afternoon. My name is Punork from Chab Dai Cambodia, and I'm also the project manager of Chab Dai Coalition. Thank you.
Sure. Yeah, quick introduction. Okay. Great.
Hello, selamat sore kalian. My name is Rachel Luschen. I'm the executive director of Unbound Indonesia.
Awesome. Good afternoon, everyone. My name is Alan Nunnally, and I'm the regional director of Asia Pacific for A21.
Thank you. Good afternoon, everyone. I am Kosal. I am from Cambodia, senior program manager for Hagar International Foundation. Thank you.
Thank you so much. Okay, I wonder if each of you could speak briefly about how you're working on prevention and what trends and changes you see in vulnerability to trafficking in each of your country contexts.
Thank you. I will be the first one to share my experience also we are working with. So good afternoon again. For me, as we are working in Chab Dai Coalition, and also we are working with community empowerment, and we are addressing about the community vulnerable, about young women who are forced and were tricked and to China, and they were forced marriage as well. And at the other side, so it's about the people in the community right now that were migrating to other country for looking for work. So the project that we are working right now, we are under the name of Community Hero Prevention Project, and we are focused more on community empowerment. And we also, the first step that we are doing right now is we try to collaborate with the subnational level from the district and also the commune level, and we are inviting them to join the training capacity related to the anti-trafficking and also the migration issue as well. And we have built them the capacity through the training session, and also we include them the practice session, how we can raise awareness in the community, how to build to understand people about the trafficking issue, because the local level, they are the most influential people. We can say they are the key people that we can work with, collaborate, and also they will be the one who are responsible to share what they have learned from us to the community. So it means that we promoting them become a community hero. We call them hero. So they will be the one who create a small group within their community. It means that one community leaders, they will create a small group with 10 people or 10 family leaders, and they will work together with them for the whole years. It means that we have planned to work with them for 6 months, and we have gathering them for 3 or 4 times. And we are coaching, we are learning, we are sharing discussion, share experience, anything, so that we can learn from each other. So this is the way that we are empower their knowledge, empower them to understand and learning together, rather than just they don't know what is trafficking is, they don't know what how they migrate to other country with illegal or illegally or something like that. So this is what we are doing in Cambodia for right now, and this is the thing that we are learning from together, and we have built each other from time to time, so that even though the community leaders and also the people in the community, they can learn from each other. So thank you. It's just only the overall sum, so we will share more if possible time.
Thank you so much. I feel like the positive reinforcement of good local actors is such a powerful tool to be used for prevention.
Yeah.
Rachel?
Yeah, so Unbound Now is currently in 13 locations globally, and we work on servicing victims as well as resourcing communities to fight anti-human trafficking. And we have a really strong belief that collaboration with all key stakeholders is how we're going to get there. And so how this kind of plays out regionally amongst the Asia region, we have 3 offices, well, technically 4 offices amongst our Asia region is in Mongolia. Our prevention work, because of the vulnerabilities that we see of a lot of women going across borders, they're doing a lot of border monitoring projects. And so it's not, they do education in schools and stuff like that, but also prevention is kind of border monitoring type project work. In Cambodia, they're doing a lot of community development. You know, if a community is able to sell enough cows or whatever, they're growing agriculturally to where they don't have to send their kids to a brothel or they don't have to send their kids abroad to be trafficked. That's another form of prevention. Here in Indonesia, for the context right now, is we realize a lot of people, a lot of stakeholders here, whether that's the local community, other people in this space, government officials don't know how to define what human trafficking is. Ask a government official and they'll say, oh, it's a runaway youth, or, oh, it's only this, it's only that. And you're like, oh, kasihan. Sometimes you're just like, oh, it's so much more than that. And so our prevention is tailored to each community that we're a part of, and we try to adapt it and stuff. So here in Indonesia, we were specifically asked a little bit to talk about our medical prevention. So we do a lot of professional trainings. We want to equip stakeholders within the ecosystem that we're a part of. So whether that is law enforcement agencies, that's lawyers, that's judges, that's teachers, medical professionals, anyone that's going to come across a potential victim of human trafficking while they're being trafficked or after they're being trafficked, so that they can better identify a trafficking victim in their place of work, or they know how to respond to a trafficking victim and service them in a trauma-informed way. So specifically with our medical training, over the last year and a half, our medical department has trained over 1,000 Indonesian doctors. I shouldn't be the one here. Those in Indonesia know Dr. Debbie. She's leading that out for us. She's currently on maternity leave, has the cutest baby in the world. I'll show you all pictures later. But her, along with some volunteer doctors, we have a dentist and a general practitioner that help us do trainings with medical professionals. It's simple. It's, okay, what is human trafficking? How can you identify it? How can we go against the myths of what they're currently believing, you know, the kidnapping myth that I think all of us have to deal with, or it only looks this way, or oh, they're prostitutes, they're just nakal sekali, or they're risky people, you know. We're trying to bust those myths with just facts and information so they can identify trafficking, so they can take away those preconceived notions, and we show them, okay, what are the red flags in a clinical setting? So that looks a little different from a dentist to a general practitioner to a midwife to a nurse. But how can they identify this in a hospital? How can they identify this in a clinic? And then what to do, you know, because they might know, okay, this is human trafficking, but you know, when you're put in front of someone that is experienced a lot of trauma, experienced a lot of vulnerability, sometimes you're if you're not trained on how to just ask basic questions, you might say some stupid stuff, or you might just not know what to say and know what to do. And so we also kind of talk through them of how to have just a general conversation with these victims that you're identifying in your place of work. If you're identifying them, how to treat them like a normal human being, you know, how to treat them with dignity and respect. And so from there, through all of the trainings that we've done across Indonesia, we've trained doctors all the way from, I don't know if it's Sabang, I need to double check, but at least North Medan, at least the Aceh area, to Papua. We have not found a single clinic or hospital or health department that has any protocols or policies on mandated reporting or reporting identification of trafficking victims in a medical setting. I don't know if that's common in y'all's places. It probably is. In America, there's already laws there where doctors and nurses have to get trained on identifying human trafficking in order to get recertified. In Texas, that's a huge thing. They have to do these 1-hour continued education credits in order to stay licensed in the state. And so our medical training that we do actually came originally from the States when we worked with medical professionals, doctors, nurses, as well as service providers to create a holistic training for them. We adopted what we did stateside, contextualize it for Indonesia, because we realize this is such a huge deal. The medical profession, or there's different stakeholders that we can mobilize in a way to be able to identify or prevent or to understand what trafficking looks like. And so we took what they do there, we kind of adopted it here, have fun with the language. Translations are always interesting. We're just training people and then realizing there's no protocols, there's no policies, there's no mandated reporting even for sexual abuse here. Not a thing. That's a thing in the Western world, not a thing, at least in Indonesia. And so we started then being like, okay, through our prevention, we're seeing gaps in the system. And we're like, okay, how can we fill in those gaps? How can we strengthen the ecosystems so that we can better support trafficking victims and survivors, how we can prevent it, and just the whole continuum of care situation. And so we're still kind of in the process of getting that pushed through. When it's not a law and there's no legal backing, sometimes it's real difficult to get that done. But we've just seen a lot of openness in being able to train professionals, not both on what is human trafficking, how to define it, unsur, as we say in Indonesia, how to define it, as well as, okay, how can we approach this in a trauma-informed way? How can we strengthen the ecosystem? How can we fill in the gaps? And so for us, it's really dynamic here in Indonesia. Things are constantly changing. And so we kind of just take what we can get. We also do some youth prevention in schools from Human Trafficking 101, or we say keeping students safe. That has parts of safety planning involved. If you're direct service providers, y'all probably know what that is, like safety planning and goal setting. We have those part of our trainings, as well as like social media safety and pornography trainings, so that youth here, we're seeing a rise in like recruitment methods with the boyfriending method and social media and all of that stuff. And then like creating safe migration materials. And so we have kind of that general idea of prevention going on here, along with like strengthening the ecosystem. But I also want to like challenge y'all that like prevention is going to look different in all of y'all's capacity, in all y'all's spaces. It's not just education talking about what is human trafficking, but it can go so much beyond that. It can go into kind of community development aspects as well, like we have in our Cambodia office, or other aspects throughout Asia. So yeah.
Absolutely. Thank you so much, Rachel. Having those frontline workers equipped to identify what trafficking is such an important part of helping to create an ecosystem that can support prevention. Alan, please, would you share what does vulnerability and prevention look like in your context?
Sure. So A21 in this region, we have prevention work in Cambodia, Thailand, and Australia. And so in those places, we have teams and subject matter experts in prevention. I am not one of those, by the way, but they research and find like vulnerable communities. And so we have a couple of different targets. So the first is vulnerable communities. Also, the second is general public and professionals, similar to what Rachel just shared. And then the third is education systems. And so we build programs around those three targets. And again, they look a bit different in Thailand, Cambodia, and Australia, obviously very different countries. But so those sub-programs are called prevention, awareness, and education. And so to be more specific, like our prevention programs will be in like border communities. We'll go to places where people are crossing daily to go work in other countries, or children are living on the borders and possibly being exploited on those borders. Impoverished communities, so just areas that don't have much economic health and need jobs and things like that. So they're also, we've identified they're more vulnerable to human trafficking. So we target those areas. And then we also have awareness campaigns where we have different videos and contextualized information that can teach the general public about what human trafficking looks like. So the public that doesn't even know what that word means, we help we produce, it's called Can You See Me? Because it's the crime that's committed in plain sight oftentimes. And so the Can You See Me campaign they're like 1 or 2 minute videos that contextualize human trafficking in that country's context. And so For example, in Thailand, we have a sex trafficking one, a labor trafficking one, and a forced begging one. And it's one that we can show those to just different people in the public sector, and they're able to better identify what it might look like, so they can then report it to whatever national hotline or whatever reporting agencies in that country. And so that's one of the programs that we use. And then the last one I'll just say is an education system. So our teams will build programs that align with education standards in those countries, and then try to get them institutionalized. And that process is a difficult one, as you can imagine, but we have actually had some success in that, and we've seen that if go through the right routes, we can get that institutionalized. And so we have a program that it's called Train the Trainer, and so we will teach teachers about how to identify exploitation and even see signs of children if they've been abused at home, or protect against OSEC or things like that. So they're able to identify it and then report it to the reporting bodies. So that's a quick run through. I'll stop there. I don't want to take up too much time, but that's an overview of what A21 does in the region.
Thank you so much. Please, Kosal, would you be able to share
The floor
about
to me,
Hagar?
right? Thank you. Okay, good afternoon again. Actually, for Hagar, we, based on our over 29-year experience in human trafficking and modern slavery responding, as a global trauma-informed care is our expertise. And because we believe that the community free of trauma when the heal happens, that is our belief, and especially for any preventive activity or mechanism in places. So you're talking about vulnerabilities based on our experience and our practicals, challenging as well here. Not only the community people, remote people are the high risk of the victim of human trafficking, but also all people right now we are facing to be a victim or to be a high risk of victim of human trafficking because of the train, because of the chain of system, because of the online scam, something like that. So everyone, not only this room, but also another people around this country, in this region, we have to be ready for ourselves, especially for our community as well, to be ready to protect and to be a part of the reducing our human trafficking rate. Okay, talking back to the prevention, why Hagar start working with more investment on preventive mechanism? Because based on our experience, we found that we are not only the doctor who waiting to cure the people who are victim, but also our work had to connect with another people around us to be a part of preventing. Secondly, we have to work with these another people to influence them to change any policy to make sure that benefit to the community, benefit to the victim anymore. And then also partnership is most important for us, because that we don't want to work alone. Advocacy, influence, or supporting to the survivor must be together, because only one is not enough. Okay, and the last one is this empowerment that you all mentioned already, empowerment. So the part of empowerment is the part of prevention as well. So talking prevention for Hagar experience, for my experience over 20 years in Cambodia, we have to divide into 3 stages, because everyone working on prevention, we have to prevent before the case happen, and during the case happen already, you have to prevent as well, and after the case happen, this is the post, we have to prevent as well. Prevent for what? Because before that, we have to protect them not to be a victim. But after they become the victim, we have to do something to protect them not to be re-traumatized anymore. So after that, they are re-healed, when they go back to the community, we have to prevent them more, not to go back to be a traffic. That is one of the mechanisms that Hagar has been using so far, because that we have many examples. Right now, we engage all part of the people around the communities, include church. Hagar have been church leading projects. This is important because they are the one who can educate people to understand clearly about what is it the human trafficking identification. So we have manual to support like A21, like Chab Dai mentioned, and like also Lady mentioned as well here. Community are our targeted to be educated. Community are the high risk, so they are the one who are involved in their own protection. So if they have skill education, we 50% already protected. already protected. This is the one of the point that Hagar successful in this engagement in really just in the human trafficking. Secondly, we also now more than 3 years already in implementation of youth engagement, community engagement, parent engagement. So this is in terms of the community people, they have to be a part of reporting mechanism that we call community-based reporting mechanism. So community-based reporting mechanism is important that for everyone to understand how to report, how to refer, and how to be protected from any kind of human trafficking or the form of human trafficking. So Hagar working on them to build more education to them, to make sure they are aware about that here. Third, we are engaged with school as well. We are working with school children. So in the school children, we have the structure. We have the school committee, we have school support committee, and also we have children council. So this is at the part of the preventive activities: school, communities, survivor, and also the family. So in the survivor, we have the survival leadership program that we have survivor networking. So they are working at the networking, so they can have together peer-to-peer, something like that. So this is just only the contribute preventive mechanism. But actually, the one who responsible to help us is the government. And the government should invest more resource at the ground level, at the subnational level. They are the one who can protect us. They are the one responsible to fulfill what they get from our complementation. This is just only what we have been learning so far. But one of the points you asked, the challengings, a lot of challenging about that here, to be result like that, a lot of challengings. Because that just only in Cambodia, many people, I don't know in Indonesia or in Thailand, the same in Cambodia or not. Mainly all the high educated people, after they graduate from school, they will not go back to their own community. They will stay in town, they will go to find another place to work. But the resource at the community, who support them back? So this is one of the challenging for us, how to build their resource more. Secondly, because of the economic impact during COVID-19 or something like that's one, high migration. So the high migration, they are facing the human trafficking and exploitation. So it is important that you mentioned about safe migration. This is one of the agenda, one of the topic for Hagar as well. We have positive parenting manual, we have safe migration manual, we have human trafficking identification manual, we have child protection manual, and we have survivor leadership manual. So this is what Hagar have been doing so far for making sure the preventive work are active in place. I think that's all. Thank you very much.
Thank you, Kosal. Thank you so much for sharing. Yesterday, some of our panelists talked about, the trends that we're seeing in trafficking recently, and I think that post-pandemic, the trafficking landscape has really changed quite a lot. So I was wondering if you could talk about how vulnerability to trafficking is changing in each of your contexts and how you may be adapting your programming to kind of meet any of those changing needs.
So thank you once again. So it's my turn again. It's about talking about the vulnerable in the community and also what the project have implemented in the community as well. So the engagement of the project, we have been build the capacity building with the community leaders, and then we have also let them raise awareness with the vulnerable people. And those people, we just only got we count them like family leaders. We took all the family leaders as our target, but we have took the most vulnerable people first who are at risk. It means that we took all from the remote area and who are the family that which are the member who are migrated and experienced or who was experienced in like a victim. But related to the victim also, we have to make sure that they are volunteer to join the project activity, as long as we don't want to raise any problem with them again because they just recover from their mental or emotional or something. So we have to be careful about this as well. So all those things we have to work well with the community leaders, and we have to recognize as well also which or who are the family that have enough time to join our project, because the project will be taking too long for the years. we're crossing around 6 months or 7 months to complete the activity as well. So we will be implement the we call awareness raising in the community for 3 times in each target family. It means that the leader will gathering for 3 times, then we have time to discuss as in small group. So we are empower them and let them to understand more clearly. So we call a networking among the village. So this is the thing that we can build capacity through them, and then also is a time let them learn, identify the risk of trafficking. And also they have to understand about the risk, or we can say risk of regular migration that lead also trafficking as well. This is a part of to understand each other. So another thing what we have learned and networking, it will be more, we can say the source stand to build individually people to understand, to volunteer and self-appointed, to be willingness to protect themselves and also other people in the community, rather than just only they learn, they understood, and then nothing sharing. So sharing is more important within the community, because they learn and then they just keep for themselves, and they without sharing to other people, no understandable for each other. So the problem is still there. So if they don't want or they don't know how to protect each other, this is the thing that we want, because it means that the family they don't learn, and then they have to share to their members, and the family member learn, then they can share to other people around the house. So we focus on the house. It means that one house, the household is 3 members, they have learned of that, and then they can share to 3 houses around them. We just only small, we count in small people, in small group. So we don't want to high number. We can compare of it. If we want to have around 40 people or 80 people gathering in a group, how could they learn? And then we can compare as well to the small group with 10 people or 15 people or 20 people. How could learn the faster? So we prefer to the small group is much more faster, even though a small group, small people, a small amount, but they could learn more than the big group. So this is the thing that we have built, even though we step by step, even though we are like a turtle step, but we will reach to our goal as well. So thank you.
Thank you so much, Kosal.
Yeah, so thankfully we had our community breakouts before this, so we can verify the trends that we're seeing. But in Indonesia, we've seen a lot more vulnerability amongst the youth here when it comes to healthy relationships. And so that's always been an issue, it's always been a thing, but it's on the rise, or it's being more reported. We don't know. Indonesian government, please share your data with us. But with that being said, we're seeing a lot more youth being recruited through social media. It's normal here. So schooling was online for like 3 years. So it started becoming normal for kids as young as like 4, 5, 6 to have tablets, to have phones, to then get on social media, to then get on gaming sites and have access to this. I think we might have seen this across the globe, but it was definitely happening here in Indonesia, which created a vulnerability. These kids lost their social skills, they lost their social networks moved online, it moved into a space where you can't verify the identity of who's in front of you. And so we were seeing more and more individuals being trafficked, especially in the sex trafficking world, through the boyfriending method, the boyfriending technique and stuff like that, being sold by their boyfriends or their romantic partner. As well as like the cyber scamming stuff. We've like talked about that, and like, so I'll kind of go to the expert. She's in the room. She does a much better job about it. But yeah, so for kind of like the youth prevention stuff, we updated a lot of our trainings to really focus on not only talking about human trafficking and defining it for people, but also talking about healthy relationships, talking about, okay, what is a safe relationship? What are red flags? What are green flags? You know, hashtag toxic, use all the Gen Z lingo and everything like that. Even we have a staff member, like he is from the Generation Z, you know, and he does a lot of our trainings to school people, murid, students, school students. Sorry, guys, my English is going. And so it's just adapting kind of those things based on the vulnerabilities. Some of the other stuff we've seen is, you kind of mentioned, it's not just low-income individuals that are being trafficked, but it's happening and spreading across the board. Kind of the cyber scamming, it's affecting really anyone and everyone to that degree. We kind of always knew that was the case, but it's a tangible thing. And so when we do trainings, when we do Instagram lives, when we do awareness campaigns, when we just talk about it with people, government agencies, we name it for what it is. We tell stories. We don't shy away from it. Like, my staff knows I'm the one that, like, if we need to go and be more blunt, that's not a common thing here in society, to send the boule to go do it. And so I go and be more blunt, and we'll just be more upfront with government agencies about, these are the vulnerabilities we're seeing, or more upfront with the, like, the moms, sorry. I was like, what's the word for Ibu? The moms in the community group that we're training, you know, it's like, we're not going to be afraid to blame or to say what's going on. We don't do it in a scare tactic of like, okay, now never let your kids outside and don't let them talk to people. But we're doing it in such a way that we're realizing you just got to name it for what it is. Because if we shy away from naming the vulnerability switches that we're seeing, the trends that we're seeing, we beat around the bush, we're doing the community an injustice when it comes to prevention. And so I would say here, because we have a little bit more of a youth focus in some of our prevention, we've seen a lot of change kind of in what we're doing with the youth. On a professional setting, we're incorporating more updated stories in when we talk about things. The Asian culture loves stories. So if y'all don't use that, even in your professional trainings, literally just add stories and it's amazing. You could literally do a whole training off of stories. We've done it before. And then I think one thing we didn't mention that I want to mention, shout out to Dark Bali. If Ashti's here, also Garasa, Bundo Johanna, we do a prevention program together. I feel like this might be unique for Indonesian because the NGO culture here is very different. We're all besties, bestie banget sih. And we love to work together. And so we've been doing these prevention programs that identify these at-risk communities throughout Indonesia. Because Indonesia is an archipelago. We have 17,000 islands, and it's kind of a hot mess when it comes to coordinated collaboration. It's a hot mess when you talk about what the vulnerabilities look like, because the vulnerabilities that are present in Jakarta are so different than the vulnerabilities that are present in Sumba or NTT or Papua or Manado. And so we've been partnering together with, there's 3 organizations, Unbound Now, Dark Bali, Garasa. We work together. We've been doing some prevention programs that are targeting some of these communities that are known source communities. And we go into these communities. We're working with local partners there. And so we were in NTT, a while back. Oh my gosh, astaga banget. I wish we could flip the language. So sorry. I know how y'all feel now. But yeah, so we were in NTT the other day, you know, like, it's huge. It's a huge source country for migrant workers. A lot of the women are going to Malaysia, working as pembantu's house helps in Malaysia and stuff, and then get enforced labor, trafficking situations. And so we're able to work with the community, do training of trainers with the communities. We're able to adjust all of our prevention materials. We share all of our prevention materials openly, and we like train and then share our prevention materials with the community. You know, we're going to be doing one in Sumba soon, and like that's going to look different because the needs there are so much different. And so we collectively take a broad focus on prevention, and we have materials that are broad focus, but as well as like very specific to the vulnerabilities, very specific to the communities, and our materials are very flexible to be able to adapt based on what's going on. But I just want to say, like, work together in prevention. Don't recreate the wheel. I don't know what y'all's cultures look like in other countries. I feel like Indonesia is like unique banget. We're very unique in the sense of like we share and we care and we're besties, and you know, we would, I wish we could all like work together and be like best buds, you know, and work at the same office if that was the case. But we've been able to learn from these other organizations because they have specialties and they've learned about the vulnerabilities of their community. Like Bunda Johanna came from Intete. She can share that information with us. And so we don't go into these places with arrogance and non-understanding of what's going on. And so like, if y'all aren't collaborating, if y'all aren't in coalitions, if you're not working together, if you're not sharing materials, if you're not training each other, change and start coalitions, change and start working together, because that's really the only way you're going to notice the changes of vulnerabilities in your population. That's the only way you're going to be able to strengthen your prevention efforts and make sure you're not recreating the wheel and just like buang uang or like throwing away money on the same thing. So yeah, sorry, that was my soapbox, but.
Okay, same question. So what happened during the pandemic and then the results after? So I mean, we saw a few trends that changed regionally and probably globally during the pandemic. We closed borders. We did see less migration, and so although there was still a lot of domestic labor trafficking and sex trafficking that was going on amongst others, the migration across borders did slow down. So we saw fewer cases of forced begging. We saw fewer cases of workers exploited who were foreign nationals in countries. But with, I think as both or everyone's referenced already, just technology started to reach places that it had never reached before, both in geography, but also in age. And so we had children online at very young ages, and we had new areas of countries that didn't have technology previously. And so with that, that can be a great thing in a lot of ways, because you can actually reach a lot more people, which is a wonderful benefit of that. However, as most everyone knows, the online sexual exploitation of children also saw a rapid rise during the pandemic and even post-pandemic. And I think what we hoped would slow down once in-person school started back and borders reopened and everything like that hasn't, from what we've seen. So that the online sexual exploitation of children is still very prevalent and is still very much on the rise. We also saw, this is out of Australia, but I think also other countries as well, we saw an increase in sextortion. And so if you know what that means, essentially someone can pose as someone they're not and convince typically a young male to send child sexual abuse materials, usually self-generated, to this person, and then they are subsequently extorted for money or like over threats of exposing that material. And so it's a huge rise. There's been just a tragedy of suicides that's happened after it. And so in response to that, A21, we've developed a couple of different programs or manuals. We have one called a Staying Safe Online Guide, and that's targeted at younger ages. And so it teaches them how to develop safe relationships, how to be safe online. By the way, everything I'm about to list is also free on our internet, on our website, on the internet.
A21 owns
on our
the
internet. We didn't create the internet, let me make that clear. On our website, these are all free. And so another one is the Safe Relationships Guide. And so that's typically targeted at teens or young adults, teach them how to engage in safe relationships, because the engagement in relationships is changing from what we knew when, at younger ages. And so and also there was another program that we got to develop in partnership with the University of Kent, ECPAT International, Player 3 Games, and University of Stirling, and it's called the EVAC game, which stands for End Violence Against Children. And it's a really neat program where it's in both Thai and Khmer. Again, this is online for free as well, but it's a game that ages between 8 and 14 can go through this game, and they learn about safe relationships and even how to be safe online as well. And so a number of different things that it teaches them through, and it can be taught in a school setting. So typically a teacher is the one facilitating this training. But another trend that we saw as well is because of the regulations that COVID put in place, it prevented a lot of our in-person gatherings. And so when we would do material distribution or trainings, we weren't able to do that anymore. So, and I love this kind of stuff, but being innovative when times are changing is so crucially important to address the issues and the new trends. So our Cambodia team, this is one of the local team members was like, well, if we can't do, like if the government's only allowing us to pass out hygiene and soap and different materials to disinfect and things like that, then let's just package soap and hygiene materials and sanitation materials with prevention guides. And that's what they did. And they distributed thousands and thousands of different sanitation and soaps to around Cambodia, and did it with prevention guides as well. So it was a really innovative approach, which I loved. We've since discontinued that because of now the pandemic's lifted. But one other one that we have continued is, one event A21 does annually is called the Walk for Freedom. And it's in every October, every country that we have operations in, but also even others, like people can host walks just to raise general awareness to the public about what human trafficking is and how to report it as well. And so during the pandemic, we weren't able to host the walks. And so in Cambodia and Thailand, we launched what's called the Tuk Tuk campaign. And so our teams bought advertisement space on tuk-tuks and contextualized it, translated it, and basically put tuk-tuks out in the city to communicate about human trafficking. And again, also we had all the government hotlines and all the different reporting mechanisms on that tuk-tuk. And then we trained those tuk-tuk drivers, professional training, a similar thing. And so we taught them, here's what human trafficking looks like. We teach them every quarter, even ongoing. And so anyways, these tuk-tuks are out in the community just raising awareness, and the tuk-tuk drivers are now educated in what human trafficking looks like and how to report it. So just 2 months ago, we had a case where a tuk-tuk driver identified that there was a house that was allowing perpetrators to come and exploit children. And that tuk-tuk driver called A21 and then called the local police, and the police were able to intervene and rescue children out of that facility. So it's like, it's in the prevention world, we all know that it's very hard to measure how do you know you're preventing human trafficking if you're preventing human trafficking, right? So, and that's a question we all should be diving deeper into. And A21 has a number of ways that we do that, but it's a lot of fun when you see a story like that you can see we actually have helped rescue a victim and get them care that they need, but also prevent future exploitation that was happening. So those are a couple of resources. There's a lot more as well, but I'll pass it on.
Thank you so much. It's great to hear about all your different innovative initiatives for both Unbound and A21. Please, Kosal.
Thank you, Ellen, that you remind us about that here. One more, the most important thing that I still value the networking and also collaboration with each other about human trafficking. You know why? Because last week on Friday, before I fly to Bali, I met 75 girl students. They are graduate high school and some in year 1, year 2 in universities. They are from 10 different universities. And then what was surprised me when we say about human trafficking, they didn't know exactly what is it. They don't know exactly what is that. So after they joined the course with me, and then they found that they feel very surprised, and they are already the victim already. Sometimes they are the high risk or the victim of human trafficking, because that they don't know exactly, they don't recognize, and that this is the root cause of the trafficker or the broker. They are easy to play a trick or to do something online or something like that, like our speaker mentioned. So talking back to, I just want to add more thing that everyone, you know, that COVID-19 is a long-term impact, and this is some of the root cause of the increasing of the number of human trafficking. But we are so the question asked to us that, are we ready for adapting anything for long term already? For Hagar, we, based on our analysis, reflecting with a relevant stakeholder, community, local authority, we found that some material are not very useful right now, and it become harmful for them as well. For example, in before COVID-19, we have a material for educating the parent to find the food for children. And then after the COVID-19 come in, those materials were not used at all anymore. We're focusing on material for washing, like A21 mentioned. But so after COVID-19 gone, it become not more flu or influenza like that here. So those material will not be used anymore for communities. We have to update our material, especially for visible, for illiteracy people at the community. It's very important for educating them. That is one of the points that most NGO, most partners, they have not yet aware about that. They're still using what they have been using 10 years, 5 years, or 3 years before. But right now, everything we have to be updated. Tool, material, mechanism, strategy, you have to revise, you have to review, and you have to adapt. Then another point that I can share based on our practice, we know that everyone are aware of any identification, but you know that the root cause of the victim, root cause of the vulnerable group, they are already the vulnerable, but because of our identification, we identify that they are not the survivor or they are not the victim. So after we found that we did not do any action with those people. So basically, they will feel more lonely and discriminated. So that is they are already the victim, and then after that, they become the high risk of trauma victim another party. So we are rephrasing about that here, and based on our community-based reporting mechanism, we include children, community, school, church. We found that many cases reported to Hagar and reported to the local police. We found them, they are already the victim already. They are victim already. 2 or 3 years already are the victim of human trafficking, but they just living in their normal life with trauma, without any care, without any treatment. So it's a very big problem. That is why networking, collaboration, coordination, connection, and communication is the most important to subject to that holistic social service support. This is very important, and this is a part of prevention as well. I mention again, prevention not only for before the case happen, but you have to pay attention that prevention can happen each stage of the cases. Before the case happen, we have to prevent what, and then during the case happen, they are the victim, we have to prevent what, and after we treat them, after we provide the service to them, they are become resilient, we have to prevent what. So this is very important mechanism for everyone who working for human trafficking. But not only this is the effective way, but just what we practice, and we found that it's very important for our community, especially for the impact of the human trafficking. Yes, okay, thank you, that's all.
Hello, absolutely. Thank you so much. I appreciate that. Yeah, primary and secondary prevention, I think, are very important ideas to keep in mind. I think we have about 25 minutes left for some questions. I don't know if we have a mic. I'm happy to, yeah. I don't know if we have someone running mics. I'll run the mics. Okay. Oh. Thank you, Caitlin. Here, Mina, please.
So yeah, like drawing the example from, for example, countering the sexual harassment or like sexual violence, we talk about not just to protect the girls, but to educate the boys. Like, I would love to know more about your thought, or if there's any actions thinking about like potential criminals. Of course, we don't want to go and accuse people, but then how is there any kind of actions towards trying to reduce criminalities instead of like, you know, on the side of protecting potential victims?
I don't know if there's any, did you want a specific person to answer? Anyone? Okay.
Okay, so on the like opposite, you mean so like criminal, like the boys, opposite forced criminality with sextortion, kind of all that. Yeah. Oh yeah, becoming potential traffickers, potential perpetrators. So part of one of at least our materials, we call it, we need to find a better name. So if anyone wants to help us, let me know. We just call it social media safety and pornography. And so we talk about social media safety, you know, be careful. But then we go into pornography because at least in kind of the sexual exploitation, sex trafficking world, pornography and human trafficking have a huge connection. And we see people become potential buyers through their porn addiction. We see people's views of women, men, boys, really anyone change when they have a porn addiction to be looking at people as objects instead of people that could potentially lead them to being pimps, traffickers, all of that. And so we address it towards the youth in a way to say like, hey, we know most Indonesian youth have access, whether it's intentional or unintentional access to pornography. Let's talk about it. Let's talk about how it affects you. Both, Fight New Drug has a thing, brain, heart, world. So how it affects your brain, how it affects your relationships, and how it affects the world. So we can just start that conversation so that it prevents either people from being exploited through kind of OSEC material, CSAM material, CSAM, yeah. Sorry, so many acronyms in this world, guys. We need to do a better job with that. Like those materials potentially being victims of, you know, sextortion, revenge porn, because that is also in the rise here in Indonesia. But then also we're hoping when we talk about it and we de-shame and destigmatize it, because at least here in Indonesia, no one wants to talk about porn, no one wants to talk about sex. Schools are asking us to come and do the talking about it because parents aren't wanting to do it, schools aren't wanting to do it. It's hard to measure anything in the prevention world, but we're hoping when we can start those conversations of like, let's not go down the track of porn addiction, there is hope to recover from porn addictions, reducing the demand, we're reducing people wanting to eventually become buyers and hopefully switching that narrative. And so that's kind of what we're doing, more geared towards youth. And then if we have the opportunity to engage with parents, we kind of do that, but it's more geared towards, like, as a parent, how to have healthy conversations about sexuality with your kids and how to facilitate a healthy relationship around that so it doesn't perpetuate false narratives, false things in society, cultural beliefs and stuff like that. So that's a little bit of what we're kind of doing, more geared towards that. Anyone else?
Thank you. So I'm trying to understand your question as well. But what we have done related to trafficking is about, for our own project, we have built like a training guideline or topic guideline for the community leaders who are the key people who are responsible for everything. So the material that we are designing looks like the calendar on the table that flip over a ball, but we increase them to like a big size, like A3 size, a little bit bigger, that easy to carry with, and also the pictures, the shape of the material is about, we design like a cartoon pictures, we produce it, and also a short message related to trafficking. And this is for the front page, and behind the page there is the guideline for the key people, the good guide, for the main point they can use in order to use the information in order to share with the people. So the key message in front, so that the people in the community, even though they don't understand, they cannot read, or they can see the pictures and they can illustrate what the pictures talking about. So we just try to do it in simply in the community. Even though they could not read or anything, so they just see the picture. Just try it in simple. So this is the way that we are trying to share those information of trafficking or sexual abuse. For the people in the community, they really like sensitive to the word sex, because sometimes we are going to talk about the sexual abuse or rape or something related to the private body, part of the body. They feel shame already, shy already. So they don't want to talk as much. But we try to convince them to talk in general, so that they could understand more about the privacy and also the touching rule or something like for their children or something. So they will learn from that pictures. And other things, we have also produced like we call a leaflet or help card. And the help card will be there's hotline number of the organization, and also we include the police hotline number as well, so that the people in community, they can report upon the time that they need help. We can intervene through the case, and all the cases that we report to another project of Chab Dai, we call a case management project, because we are connected to project each other. For us, we are community empowerment, so we are working in the community, and then when they report the case, we refer to another project. So that's all what we have done. Thank you.
No, please, please.
I'll make one quick comment. So it's a great question, because if we can kill the demand for human trafficking, right, then none of us would be sitting in this room. So A21 does not have any programs that are targeted towards reducing criminality or preventing criminality. However, tomorrow is a really good session. Matthew Clark, who's in this room as well, he is doing a session tomorrow at 2:00 that is entitled "Incorporating Perpetrators of Human Trafficking into a Theory of Change." And I've had a conversation with him and his wife before, and they've done a tremendous amount of research and study about how to do this, how it could work, and incorporating that into our program models. So I encourage everyone to go. It's going to be a great session.
Thank you. Caitlin, I wonder if I can throw you under the bus a bit and ask you to speak about the research you've done with trafficking and traffickers and trafficker profiles. It just seems very relevant to the question.
Sure, and I just happen to be holding a microphone, so. So Matthew and I also have had some conversations about this. Blue Dragon did some analysis of, and I can't remember the numbers now, but about 80, I think, court cases, human trafficking court cases. So we had access to the court case documentation, so we had information about the traffickers. So we did some analysis of the demographics of the traffickers, and basically in a line, what came out was that the traffickers were pretty much the same vulnerable demographics as their victims. Now, this is not a representative sample because it's only those traffickers who've been arrested and prosecuted. So it tends to be the recruiters and the transporters, the low-level traffickers, not the organisers or even the buyers. But it's interesting in that, these traffickers are basically driven by economic need and social disadvantage. So many of them were ethnic minorities, very poor educational background, very low skills. So they were choosing to sell their neighbours basically because they had no other choices. So we're targeting now our prevention work, but also our economic development risk reduction work at the communities. The traffickers actually live in the same communities as the victims. So by targeting whole communities, whole vulnerable communities, we hope that we can actually provide other options for both traffickers and victims so they don't have to put themselves at risk of either perpetration or victimhood. So the report is available on our website, and it's actually, we're updating it now because it was 2021, I think. So we're updating it with more data, and that'll be on the website when it's out as well.
Thank you so much. Thanks
and I
for
think
letting
we
me
have
do
a
that.
question online.
An online question?
Yes.
Great.
Yeah, this will be for Hagar specifically. How do you successfully engage duty bearers and local government persons in prevention work? Any specific methods you find to be more effective in engaging them?
Okay, thank you for the question. Actually, this is the like Ellen mentioned, that we don't have any specific indicator to measure about our successful prevention work. But in terms of collaboration, is the most important, and we prioritize about the first communication with those local authorities is the most important, because that they have structure from national level, provincial level, district level, communal level, and village level. So at the beginning, he got engaged ourselves into each mechanism. From the commune level, we are the part of commune committee for women and children. So every meeting, every monthly meeting, we are the one who can join with them to hear, listen, and share our concerning during that the meeting. So that is the part of the way that we have effective communication with those local authorities. Third, because the local authority are the one who are the key person to protect, fulfill, and respect. So our way of work with them, we have to allow, we have to flexible with those three kind of things. For example, how to fulfill. And we know that the government is very strong, everything, but at least at the ground level, they don't have enough resource to complete this skill. For example, child protection in emergency, they don't have the skill about that here. So Hagar have resources, we can try to talk to them and we can provide them another skill, mentoring, coaching, leading, directing. So this is another way that we can connect with those local authority easily. So the fourth is the most important point, that sometimes national level policy change is the most important, that we call influence or advocacy. Hagar also working at a part of contribution to change a policy as well at the national level. For example, recently we joined with MOJ, Ministry of Justice, to develop the Union Justice guideline for the child victim, for the children involved with the criminal. So this is very important guideline that Hagar can join and then can advocate them to listen to our practical issue with the children and conflict with the law. This is most important. So this four main point that we can be the one who responsible and to work with them under the very complementary approach, not the defending or not this protecting, something like that here. Okay, thank you.
Thank
Hope
you
to
so
answer
much,
the question.
Kosal.
Okay.
I think we have time for one or two more questions. I don't want to hold you back from your dinners. Try test.
Yes. Oh yeah, it's on. Thank you. My name is Winda. I'm from Indonesia. Working with Compassion First or Yayasan Kasih Yang Utama. So our organization focus on prevention and then also recovery for the child survivor of sex trafficking. So as an organization, they're doing a lot of work for sex trafficking. We realize the Indonesian government did not really do a lot of work related to sex trafficking, but mostly labor trafficking, like a lot of work. And there's a lot of organization also doing like the same work, but not really like, I won't say not really, but just less government and less organization focus on sex trafficking, which is in Indonesia is like a lot right now. And it's even like more improving, especially through COVID, through that like OSEC and then like, like, because I think it's same in every country, right? Like OSEC is really high now. So my question is like, do you have any experience maybe in your country, like how to encourage the government to do more work, maybe to prevent sex trafficking to happen? Like, because in Indonesia, we have like some area, I won't maybe mention the name of the place, like some area like village that prostitution is common. And then child got, involved in that, and then parents feel okay to sell their children into the prostitution, whether like online or through the won't say online, maybe like through some of the, like in Indonesia there's a lot of we call that tempat hiburan malam, like cafe or pub or massage place. They actually trafficking, prostitution happen inside those places. So maybe if you have similar experience in your country, can you share tips for us on how to encourage government to like, doing this? And then also if you have experience working in the village, which is, because it's talking about something that common or become a habit into that village. So how actually to giving, to working on prevention to help those villages to understand that this is not good to sold their own children into the prostitution. Thank you.
Thank you.
Thank you. Actually, the time is sexy right now, so I just to try with some answer already from the first question that online question asked, but I want to add one point, very important. The most important point is that every government, they have national action plan. For Cambodia, they have the National Committee for Counter Trafficking. They have national action plan to reduce sex trafficking, reduce human trafficking. So in those national action plan, they indicate clearly about how many of the people they willing to do with this work. So they are already action. So if our partner want to work to cooperate with them, we engage our activity into the national action plan is the most important point that we can join with the government to do that. So we engage them easily as well here. The most important, yeah. Thank you.
Okay, setuju banget sih. So context for bringing people in, it is not polite to talk about sex trafficking. It is not appetizing for government agencies here to hear that, to talk about it. But it's a huge thing. Like, I'm like, okay, you know, freaking Cambodia did this stuff with the cyber scamming, where they arrested 500 traffickers, recovered 1,500 potential victims before leaving in June in a 10-day period. Okay, it's super easy to do these tactics on sex trafficking, on prostitution, online things. So I can pull from kind of what we do stateside and what I'm really hoping we can do here, you know, hopefully, you know, if you have funding, holla. But so we engage a lot on, okay, how do you put this? There's a lot of corruption here. You got to find the good apples. You got to find the people that actually want to make a change here in Indonesia, that aren't just wanting to line their pockets with money. That's just a reality that we have, but are wanting to change. It gets freaking annoying when they move. I'm gonna be honest, y'all. It gets freaking annoying when they move, you know, Bapak Kapolda from one thing. You made an amazing relationship and they're like, oh, ayo, pindake Riau. And you're like, Astaga, you know, and you have to rebuild those relationships within the police network of your region because they're constantly moving every 3 to 5 years, or you're having to rebuild those like political things. But I would say what we've seen stateside, most of our cases that we work with are sex trafficking cases, child sex trafficking cases. We had the Louisiana government come to us and asked us to specifically open up offices in Louisiana to focus on child sex trafficking cases because they have such a huge problem there. And so it's a priority for the government. It's real hard to make it a priority for the government. I'm like, how can we get the Ibu governors, you know, how can we convince the people in power to prioritize this? Because if you look at the Special Regency of Jogja, it's not the Ibu governor, but the Sultan, Ibu Sultan, apa sih? Yeah, y'all know. Apa? The queen, yeah, pretty much like the queen. Yeah, the like queen of Jogja had a special heart for, it was more geared towards abuse and, right, child abuse and gender-based violence type stuff. And so she prioritized it, and now they have like advocacy centers, they have a stronger network there, and it's a priority in the government and stuff. And so it's Thursday, Friday, we'll like action plan this, you know, it's like, how can we get the right people and the right power to like want to do something about it? Because here in Indonesia, they're trying to save face. That's why they don't share data. We know, call it what it is. The government doesn't want to say this is an issue, but they don't know how to address it. But what I've realized, like in Lampung, when I've had conversations with different like dinas, I'll just say it's happening. Like we tell them cases. I mean, y'all have so many cases y'all can share, obviously ethically and stuff like that. But it's like figuring out those key people. Let's be strategic and like, you know, like headhunt the right people. I'm just kidding. But yeah, it's like, how can we be strategic here in Indonesia? Because it's so unpalatable on a government level. Corruption is such a huge thing here. People don't want to report sex trafficking. I mean, and there's a freaking brothel in Bali that the police don't want to touch because orang polisi punya itu ya, like it's someone high up in the police or like TNI owns that place, and so they're unwilling to touch it. It's the same, the place of prostitution in Lampung, someone high up in TNI owns the land that it's happening on near the port, and so they just let it happen. And so that's where the parts of accountability like come into play. We hope we can get a national action plan, but are they going to follow up with it? Most likely not. That is the reality. But it's like, how can we push it through? Y'all, Indonesia is a hot mess when it comes to certain things, but there is potential. Like we're seeing, like we did a huge training in Poland. Sorry, I'm gonna just off. We did a huge training in Poland. Poland has a lot of sex trafficking going on right now, especially with the war. A lot of the police officers there were like, just legalize prostitution and you'll be fine. And we're like, no, that's a whole nother conversation. But we just did some basic training. We brought alongside a some hakim pengacara jaksa, judge, lawyer, and judge, lawyer, and prosecutor, along with service providers, and we just did trauma-informed care training. We talked about sex trafficking. We gave them examples of what does it look like. We painted pictures for them. We brought them into the conversation, and they all walked out from those trainings of like, oh, this is a huge issue that we need to do. And like, I'm hoping with our rollout, we're gonna have a rollout in Jabodetabek area of training with Dark Bali for astaga, orang polisi, CSO juga semoga bisa ikut itu supaya nanti kita bisa belajar bersama, kita bisa bercerita sama orang polisi, sama orang di dinas-dinas juga supaya mereka tahu itu satu hal sangat penting di sini, terutama karena itu anak loh, you know. Jadi semoga mereka datang bisa bercerita bersama, semoga kirim orang dari Compassion First juga supaya kalian bisa bercerita tentang korban, kalian melayani di situ, karena mereka harus mengetahui. Setiap kali saya ngomong sama orang dinas dan bercerita tentang pengalamanku di sini tentang perdagangan manusia, mereka sangat kaget, tapi sebenarnya ada shift dalam otak mereka dan hati mereka, dan sebenarnya mereka realize, akhirnya mereka tahu, oh harus melakukan sesuatu dan sebenarnya bisa melakukan sesuatu, sebenarnya bisa, dan itu memulai hubungan sangat penting untuk menjadi, tahu apa sih, melihat Indonesia masa depan lebih baik juga. So I don't know, sorry, I just went on that. That's what I would say with that, is just like, don't be afraid to share your stories. Like, especially with Compassion First, like y'all have so many stories, obviously in an ethical way. But like, I think that's like where we're gonna see change, and that's where I've seen change go further.
Great, okay. Any other members of the panel want to give a crack at that last question?
There's sometimes, anyone else? Ambil
Okay.
sekarang supaya nggak lama.
In that case, I think we're going to wrap up. I don't want to hold you back from enjoying your evening in Bali. Will you all join me in thanking our panel for speaking this afternoon? Thank you all so much. We will see you back here tomorrow at 8:30 for our final day of the conference. Thank you so much.